Veterans Affairs is currently embroiled in a scandal in which the department is being accused of facilitating medical care for illegal immigrants, while they're failing to provide adequate care for our own veterans. Joining us now to discuss is retired U.S. Air Force Captain Darren Selnick, a senior advisor for Concerned Veterans of America. Darren, thanks for being back tonight.
Thanks, Kara. Thanks for having me on your show. Important topic. Appreciate it.
It is. So what exactly is being alleged here about the VA in regards to the migrant crisis?
Yes, I had a Border Patrol agent come to me a couple months ago about how VA is paying for unauthorized migrants to get health care. And we've been investigating and we've seen a whole bunch of documents. So what's happening basically is that if you're unauthorized migrant and you are in custody of Border Patrol ICE, they very quickly make an appointment, get you an appointment, take care of your health needs, dental needs, take you there, take you back, and make sure it's processed. ICE and Border Patrol have an agreement with the VA where all the community care providers who handle the unauthorized migrants send their medical claims for processing and payment to the Department of Veterans Affairs, who promptly pay it and send it to you. They have a website, they have customer service lines. And so, yes, they are facilitating what is going on with Border Patrol. But at the same time, the Undersecretary of Health did a virtual town hall where he told all the medical centers to make it hard for veterans to get community care. So if you're a veteran, VA is making it hard. They said, don't hit the easy button for community care. Default community care is the last option. And at the same time, they're helping ICE and Border Patrol make it easy. So easy for unauthorized migrants to get health care and dental, hard for veterans. It's not right. It needs to stop.
That it does. I mean, that's really the gut punch to all of this. And I know this actually predates the Biden administration. And I know you served in an advisory capacity when it comes to the VA during the Trump administration. And you and many others, even, congressmen as well, are saying that this is news to them. They didn't even know this. They said if they had known this a few years ago under Trump, that, they would have done something to stop this, to mitigate, to use whatever powers. But is that strange? Was this just hidden? Was it covered up? What exactly has been going on these last few years?
Well, I was dumbfounded because, I worked as a senior advisor. I worked in the VA for 9 years, all the way back to 2001. Never heard of it. Talked to other political appointees, never heard of it. Members in Congress, never heard of it. Senator Moran asked in a hearing 3 weeks ago to VA, under what authority do you have to do this? The VA staff said at the hearing, we never heard of it. We don't know about these allegations. So Congress and everyone else, so somebody in the VA was doing this. They weren't bringing it up to the political appointee level, but they were doing it because they thought it was a good idea for whatever reason. At the meantime, they're processing lots and lots of claims. In 2022, they processed 161,000 claims or more. That's not insignificant. And so it really struck us at CVA. Why is it so easy? Look, if you're an unauthorized migrant and you have a broken arm, we want you to get it fixed. That's not the issue here. The issue is VA is to serve veterans, not to serve DHS, not to serve unauthorized migrants, not to make it easy. They should be making it easy for the veterans to get care. Instead, they're doing everything in their power to make it hard for community care, which ensures timely care, while making it easy for other agencies and easy for unauthorized migrants. It's not right. We've been calling for an investigation on this. We hear that there are some investigations going on in the Senate and in the House. We would like those to become more public, but we would also like legislation to stop it. There's no reason that VA should be doing this. We have veterans that are getting bills and providers that are not getting paid. And so the capability to do this is fine, but it should only be for veterans. No veterans should be getting a bill. Providers should be having the easy time to get paid and be serving veterans, not a hard time making them leave the network and veterans getting billed, which destroys their credit. It just doesn't make any sense, needs to stop.
That it does. And I know the VA, they put out some statement, and I have part of it here. They say the VA does not provide or fund any healthcare services to individuals detained in ICE custody. And they go on, more to that effect. But what do you make of some of those responses where they're saying that they are not funding or providing healthcare services? Or do you think perhaps they're dodging the facilitating aspect?
Well, they are parsing words is what they are doing. So if you are processing medical claims and you are paying medical claims, even if you get a reimbursement for it, it doesn't mean that you're not facilitating what is happening.